Channel 2's Rochelle Turner live at a small health clinic on Hillcroft tonight. Rochelle, has that clinic ever had the vaccine?
Christine, they have not. As a matter of fact, they are waiting to get the COVID-19 vaccine. The director tells me that most of her patients wouldn't feel comfortable going to one of the hubs because they're already dealing with several language and cultural barriers. She says they're just waiting to get the vaccine right here.
Very bad, and it's a shame.
That's how Dr. Forough Farizani feels about not receiving the COVID-19 vaccine. She's the director at the Hillcroft Physicians Clinic in Gulfton and says they were approved by the state health services to provide vaccinations several weeks ago. But since then, it's been nothing but excuses.
They all say they don't know, it's just in the process, and we don't know how soon you're going to get it.
On top of that, none of her staff members are vaccinated, and patients like Allison Finer want to know when the vaccine will be available.
We really need help. We really need this vaccine so we can get back to our lives.
The Episcopal Health Foundation says Gulfton is already struggling with COVID-19 and health disparities. Most families are on a low income and live in a crowded household.
They were on day one more vulnerable to getting the virus in the first place. And because many of those same groups already had pre-existing conditions, if they did contract the virus, they were more likely to be sicker, to need hospitalization, and ultimately to die than non-white populations.
Dr. Farizani serves about 20,000 patients who work in the community. She says it's important for them to get the vaccine so they can protect themselves and their families.
They don't feel comfortable going to grocery store to get their vaccines or to CVS, even Walgreens, because, they have underlying conditions.
And the Department of State Health Services did send us a statement which reads in part, "We know there are a lot of people who want to be vaccinated, but there just isn't enough right now. We'll get more each week and we will continue to allocate it around the state." And they also went on to say they expect to receive about 121 doses of the vaccine next week, and it'll free up some room after they send out most of the vaccines to some of their long-term care facilities and pharmacies. Reporting live here in Gulfton, I'm Rochelle Turner, KPRC Channel 2 News.
Rochelle, thank you.